今からラビのが始まるんですけど。
As I said in the first slide, I and Dr. Nanda, the next speaker will be the highlights of the symposium. And please, we welcome to Forsyth Institute Symposium. Thank you very much for your attention.
Yes. 今からラビの公演が始まります。人いっぱい来ましたね。
I have to introduce myself, that's why I'm doing that. And I am editor-in-chief of Progress in Orthodontics, which is an open access journal. Anybody can log in, there's no firewall. I am also Professor Emeritus at University of Connecticut, and I'm adjunct professor at the Forsyth Institute in Massachusetts. As you all know, I spent probably 47 years of my life at UConn, University of Connecticut in Farmington. Now, the outline of this lecture is going to be, most probably I'm going to talk about exclusion arches, infrazygomatic tads, palatal tads, surgery first, and a little bit about aligners. So my friend Kenji Ojima created a difficulty index for Openbite cases. And if you don't know, I worked very closely with Kenji on his patients and on his presentations. So you will see that if you divide on the basis of difficulty, just looking at the teeth, you can almost figure it out what kind of treatment you are going to create for Openbite. Here what we are saying is that if you know the difficulty, you can change the treatment plan and choose accordingly. She looked at 250 cases, she found 45 which she could use because there was no extraction, no tads, no surgery, they were just clean cut. So what was going on in these patients? Basically, Invisalign was used because that's what he uses. One operator, 2 to 3 clinics, so aligner treatment. So this is a typical patient, you can see, and very nice result. There's one orthodontist I'm really impressed with is Kenji in the world. What is the biomechanics of Openbite correction? Well, if you look at Charlie Burstone, the way he described that if you place some bends in the wire, it'll be quite different. Okay. Unfortunately, I get a lot of nasty messages that people can't find the book because Elsevier's goofed because whatever they published was sold in 2 weeks. And now they tell me that the next batch is going to come sometime in June. What do we do when we talking about biomechanics and Openbite and aligners? We are again talking about aligners. Materials, I always talk about shape memory. Materials are very important. Now you find, I was surprised to find there's a company this morning, Graphy. They have a shape memory aligner material. So you can see we are progressing now first time in the area of materials. Until then, everyone was, let's move the teeth. Where are we going to move them? I think the material is extremely important because it is almost like shape memory. What revolutionized orthodontics was at University of Connecticut when we developed EMA wire. So shape memory alloys have really changed us, and I think aligners are going to be changed because of this shape memory kind of thing, which is going to take place. So attachments are important, indirect printing, refinements, compliance, stability. I always say that we don't have to be slaves of the companies because you really have to do the treatment plan regardless of which company you are using. The CliniCheck is the time where you are going to do your treatment plan. Junior Sugawara came up with also a very nice system, which was a scalpel electric system for patients who needed a lot of force. But then the same thing comes in, the hearts in every class 2 patient. So what are we doing here? We place this parallel gizmo there. There are hooks there at different points because as we are going to include the posterior teeth, because these are the individuals I have worked recently, I have worked with a lot of people in the past. These are some of the books I did over the years. People always ask me, why do you do the books? I say, you know why? Because if I want to know something, I can't figure it out where I read it, which year I read it, which journal it was. In the book, it's a reference. You can read it. It's all in there for you, okay? So with this, I want to thank all of you, and you've been wonderful. Thank you.
He has more followers. Yeah. Ravi.
Kenji!
Congratulations. Ravi's font. Yeah. Photos.
Ready? Yeah. Back from here. 1, 2, 3.
Oh, nice. My grandniece. Okay.
So like this.
Yeah, I saw her.
No, too close.
Hi, Dr. Jima. How are you? You think you're not coming to the dinner tonight?
Yeah.
Good. Let's see that.
Okay, guys, I have COVID. Okay.
Doctor, please.
Oh my God.
No, déjalo.
Sandoval. Okay, doctor. It's not okay. Okay.
Thank you.
Come on, guys. You want to
For Chile.
Yay! Chile. Nicaragua.
Cái bản của đi rồi đó.
Palacio.
Nicaragua.
Can I have it too?
Yes. I gotta go.
Please.
You already took it. I saw it.
Really, one picture, please.
Okay, I will.
Yes, no.
Okay. Okay, hold on. I am not leaving. I'm here for 2 more days. Okay. I will be here for 8 days. Take a picture.
Yeah.
Please.
Ravi. Congratulations.
No, you don't.
A lot of people want to eat.
Oh no, please. No.